John Pulu.
Noa ia e Māori, ni sambulovinaka ho e ki pia moe kakai whonua. It's a little after 4 p.m. For us here in Tāmaki Makaurau, Aukalani Aotearoa Nusila, taritari fia ki mō tōlu. Koe whainga Māori e koe ni, toi hoko atu pe, tau porokalama I honoa, toko atu at nau tōlu koe ni, nā nau mau e ngahi whakailonga as part of the King's Birthday and Coronation Honours list for this year. We are very delighted to welcome back Dr Ofa Dewes, who has been named as part of the King's Birthday and Coronation Honours list. Now this time she is receiving an MNZM for services to health and the Pacific community. Dr Dewes, noa ia pia māloelelei, Buluvinaka, welcome back to PMN Tonga.
Maloelele Sione, and maloelele to all your listeners. Thank you for the welcome.
Whawhetai. Congratulations to you, Toketa. Whawhetai, this is such a wonderful news and recognition. Tell us how you feel.
It is indeed an absolute wonderful recognition. I feel very happy indeed for the acknowledgement. I feel also very humbled because this means a lot, not only to me, but also for the Pacific communities that I work with in our health research and the value that they bring to our work. And so it does make me very happy. It does make me feel emotional as well when I think of all the people that have been involved in my journey, which spans close to 20 years in health research, not counting the years before that in the different sectors I've worked in. But this award acknowledges all of our contributions to health research and the Pacific community in New Zealand, especially the Tongan community. And I must recognise that in addition to this is my role on the board of the Tongan Health Society and leading the research in the community with the Langimalia Research Centre.
And that's just one of the many hats that you wear, because I'm also aware that you were an associate investigator with the Maurice Wilkins Centre for Molecular Biodiscovery at the University of Auckland, and also research fellow at the School of Population Health, School of Nursing, Department of Molecular Medicines and Pathology, and Centre of Methods and Policy Applications in the School of Social Sciences between 2005 all the way up to last year. So you have been very busy. Tell me about how it all started for you, for your passion for health, and then now that you also work in the community with the local board work. But let's go back to the very beginning, Toketa. Where did this passion come from?
Indeed. Those are the fond memories I have from 2005 when I was given the opportunity by Professor Robert Scragg of the School of Population Health, and that was to manage the baseline data collection for a research project on obesity prevention in communities. And we engaged this high schools in South Auckland in the study. Our study was part of a regional study, and that included Tonga, Fiji, and Australia. But my role on the project in New Zealand was to manage the data collection and to ensure that we did it well. And I'm very proud of that project. Oh, yeah. We had a very strong team under Professor Scragg's leadership. That actually triggered my interest in working with Pacific communities to address the priority health challenges that they were facing.
Oh, yeah.
At the same time, I saw opportunities to build bridges with other research centres, other researchers in areas that were not addressed at the School of Population Health, and so that led me into molecular medicine and pathology, where it was important to engage the scientists that are investigating the cause of the various diseases, and then building bridges along the way, bringing the community, Pacific community, with me also, so that the scientists I work with will have a better understanding of the Pacific peoples that I live among in South Auckland, and to appreciate and value and be aware of the challenges they face. And so, I still maintain those links with them, that Department of Molecular Medicine and Pathology, because that was the link to the Maurice Wilkins Centre. And as you may know, that centre is one of New Zealand's national centres of research excellence, focusing on infectious diseases, as well as non-communicable diseases like diabetes and cancer, and some of the major health challenges our people are facing. And so the journey just continues. There was another opportunity. There's a gap in our School of Nursing. We need research to investigate, well, rather to understand the experiences of Pacific family carers looking after their loved ones at end of life, and then extending to even family members looking after family members living with a long-term chronic condition. And then so it continues again into another gap we have in our research, and that is in data science, with a lack of data scientists to be trained and supported to investigate or interrogate big data sets like we have in Stats New Zealand, like we have in the integrated data infrastructure. And so I'm excited that along the way, opportunities have been given for young, early career researchers to begin to develop their own research careers in specific fields. And now we are seeing Pacific researchers completing their doctoral studies in genetics. And I'm pleased to say that I'm supervising one of those students along with two other supervisors.
Fantastic.
And giving them the opportunity to be trained in areas where we currently lack Pacific researchers, research scientists, and that for me is very, very exciting. It gives me much joy to support the stars, actually future stars, in the work we do, because they are intelligent, and I want to see them excel in the work they do, completing their master's and doctoral studies, and then creating pathways for them to become fully fledged research scientists. And what's also important is attracting the right support for them, so that they have supervisors that supportive of them and will provide the necessary sponsorships and funding for them to develop their careers. Because without funding, we can't do our research, just as much as without our communities, we can't do our research. So it's very, very important to have all those important contributions in our work.
Whawhetai. And Dr. Dewes, I've been very fortunate to know you over the years with the work that you do, but I think you've been a great leader in this space, and you've shown us or spoken about the importance of data and research and how this helps us move forward. But also, you've just highlighted the need for more Pasifika, and it's great to hear that there are some others, following your footsteps. It must be a really good feeling that we do have representation in this space.
Oh, yes, it is. And that's very, uplifting to know that there is an emerging group of intelligent Pacific researchers who will be the leaders, the research leaders of the future. Where once, in 2005, I saw a huge gap in Pacific research leadership. Today, I'm very encouraged to see the leadership amongst our young researchers. If you look to Associate Professor Diane Sikapotonu and all the good work she's doing at the University of Otago, we have Dr. Natalie Netzler, and some people may have heard about the work she's doing, explaining the science behind COVID and going into the community. Yes, that is very encouraging, and I'm confident that the number of Pacific research scientists will continue to grow as we support them and introduce them to the right networks and ensure that they receive the finances that they require to do their work. Because all this is important for informing precision health, the treatment we need, the prevention, the right prevention for the right population, and the right treatment for the right individual. And all this work is happening now, and the acknowledgement of this honour takes into account what Pacific peoples are capable of doing. And I'm just so excited for the communities. And Pacific peoples now are articulating their voices very well in the research. Whereas previously they would be very shy to be involved in research. It's not the case now. They want to be involved, and they should be involved because it's their experiences that we need to understand in order to be able to inform the right models of care for them and help achieve better outcomes for them. We still have those health challenges, but we can overcome them.
Whawhetai, malo au pito Dr Ofa Dewes ai omi ai ngahi whamatala whawha ofa koia mo mahu inga whoki ke mea ho eiki pela hu ilo ke kakai whanua. Congratulations, a well-deserved recognition to you, Dr Dewes, and the work that you continue to do for our community. Ho eiki pea mo kakai whanua, that was the voice of Dr Ofa Dewes, who has been recognised in this year's King's Birthday and Coronation Honours for his services to health and the Pacific community. Whaiaksia? Malo apito toketa.
Malo ngawe mehena, and please keep up the good work there, Sione. Ofa atu.
Ofa lahi atu. Take care.
Bye-bye.
Bye-bye. Hau eiki pia moe kakai whanua. Namo toki